Hello everyone and welcome back to our channel. If you're passionate about health and wellness, or just want to understand more about the fields of health education, promotion, and information, you're in the right place. Today, we'll break down essential concepts, definitions, and differences between these crucial aspects of health. So, grab a healthy snack, and let's dive in. Health is a very abstract concept to conceptualize and measure, and it is too difficult to put in words. There have been many attempts to define health in meaningful ways, but opinions regarding what has to be understood by health differ across and within healthcare disciplines. Health has both objective and subjective aspects. Someone may have a disease without feeling ill, or, conversely, someone may feel ill without having a disease in the medical sense. Therefore, health is defined in its broader and more holistic concept. The most commonly accepted definition is that formulated in 1948 by World Health Organization, which defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. To more fully understand the meaning of health, it is important to understand each components of health. Physical health refers to the absence of diseases or disability on the body parts. It is the biological integrity and the physiological well-functioning of the human body. It is also the ability to perform routine tasks without any physical restriction. Mental health, termed as psychological health, and it is a subjective sense of well-being. It has two major components: cognitive and social health. Cognitive health. Cognitive health is the ability of an individual to learn, perceive, and think clearly. Example: a person is said to be mentally retarded if he or she cannot learn something new at a pace in which an ordinary person learns. Emotional health. Emotional health is the ability of expressing emotions. Example: fear, happiness, and to be angry in an appropriate way. It is also the ability to maintain one's own integrity in the presence of stressful situations, tensions, depression, and anxiety. Example: if somebody gets into coma during an examination. Social health. It is the ability to make and maintain acceptable and proper interaction and communication with other people and the social environment, satisfying interpersonal relationship and role fulfillment. For example, to mourn when close family member dies, to celebrate festivals, to create and maintain friendship. Spiritual health. Spiritual health is also called personal health, and it is a reflection of self-actualization. It is also a relation of health with religion or cultural values and beliefs, and is a way of achieving mental satisfaction in stressful or in other ill health conditions. For some people, connected with religious beliefs and practices; for others it has to do with personal beliefs, principles of behavior, and ways of achieving peace of mind. All aspects of health are interrelated and interdependent. Physical problems can lead to mental problems and vice versa. Therefore, health should be viewed as a holistic concept. Health education. Health education is a part of healthcare concerned with promoting healthy behaviors. Since an individual's behavior can be the main cause of health problems, it can also be the main solution. Through HE, we help people to understand their behaviors and how it affects their health, and encourage them to make their own choices for a healthy life, without any coercion. Health education is aimed at bringing about behavioral changes in individuals, groups, and larger populations, from behaviors that are presumed to be detrimental to health, to behaviors that are conducive to present and future health. Health education is the process of imparting information about health in such a way that the recipient is motivated to use that information for the protection or advancement of his own, his family's, or his community's health. Health education covers the continuum from disease prevention and promotion of optimal health to the detection of illness, to treatment, rehabilitation, and long-term care. It includes infectious and chronic diseases, as well as attention to environmental issues. Any combination of learning experiences designed to facilitate voluntary action conducive to health. Let's elaborate on this definition. Combination emphasizes the importance of matching multiple determinants of behaviors with multiple learning experiences or educational intervention. Designed distinguishes health education from incidental learning experiences as a systematically planned and organized activity. Facilitate refers to creating favorable conditions such as predispose, enable, reinforce. Voluntary implies full understanding and acceptance of the purpose of the action.
Action means behavioral steps taken by an individual, group, or community to achieve an intended health effect.
In general, health education is referred to as the process by which individuals and groups of people learn to behave in a manner conducive to the promotion, maintenance, or restoration of health. To reach a state of complete physical, mental, and social well-being, it is beyond the activity of health education and even health sectors. In other words, health is not just the responsibility of health sector alone, but the responsibility of every sectors working for development. Thus, the concern for health outside the healthcare sector is the call for health promotion. Health promotion is the process of enabling people to increase control over and to improve their health. It is a positive concept emphasizing personal, social, political, and institutional resources, as well as physical capacities.
Health promotion is an umbrella term that includes disease prevention, improvement of health, and enhancing well-being. Health promotion can be defined as
a combination of educational and environmental support for actions and conditions of living conducive to health. Combination refers to the necessity of matching multiple determinants of health with multiple intervention or sources of support. Educational refers to the communication part of health promotion.
That is health education.
Environmental refers to the social, political, and economic, organizational, policy, and regulatory circumstances influence behavior or more directly health. Health promotion has the following characteristics. Health promotion is a process, a means to an end. Health promotion is enabling done by, with, and for people, not imposed upon them.
Health promotion is directed towards improving control over the determinants of health.
Health education is one of the most important components of health promotion. It is a means of promoting health, prevents illness, cures disease, and facilitates rehabilitation. Health education is primarily focused at voluntary action of people which can be undertaken by their own to improve their own health, their family's health, and the community as a whole. Health promotion aimed at the social and political actions that will facilitate the necessary organizational, economic, and other environmental supports for the conversion of individual actions into health enhancements.
Health information. It is health facts disseminated to the target audience, focusing on the basic facts related to the health issue under consideration. In dissemination of health information, baseline information or data is not necessarily required. Let's compare health education and health information. In health education, baseline information or current level of multiple determinants of behavior are necessarily required. In health information, baseline information or current level of multiple determinants of behavior are not necessarily required. Health education is appropriate for old problems or problems known to the people for a long period. In health information, appropriate for newly emerging health problems and during epidemics. Health education is required at all stages in behavior's change continuum. It is continuing, even to prevent defaulter after adoption. But one-time telling facts provided that the information reaches all the intended audiences and understanding takes place in health information. Health education encourages people to make their own choices for a healthy life. Health information is merely telling people to follow healthy behaviors. Health education focuses on the reason behind behaviors, whereas health information is blind to the reason behind behaviors. In general, health information is not the same as health education. Correct information is certainly a basic part of health education, but health education must address other factors that affect health behavior like resource availability, cultural norms, social support from family members, and other factors related to the health behavior. Thank you for watching. Don't forget to subscribe our channel for more videos. And gives us thumbs up if you like the video.